Hello, my name is Molly McDonald, and I'm going to be doing my infectious disease presentation on syphilis, or Chyponium pallidinum. As you can see, here is a picture of the syphilis. So we're going to be starting off with just syphilis, an overview. So it is pathogenic, so it does cause harm to our body, and it's very slow growing. It's actually really weak outside the body, so if you mess with the temperature, you put it just even outside the body, it'll die very quickly. It spreads by contact, so we can think about contact in sexual acts, we can think about contact in hygiene, so in third world countries where their hygiene is not very good, it kind of spreads upon the children and even in the adult world. So this is actually one of the most prevalent sexually transmitted diseases, and so it's something that we need to focus on because it is actually harming adults and children. So worldwide there was 36 million cases, and there's actually about 11 million new diagnoses annually. As you can see here, this is the Tuscany study, which was done in the early 1900s, and this was an unethical study that was done to African American males, and there actually a lot of them passed away, or they had a lot of the neurological deficits that we'll be speaking about, and this was in America. So here are some pictures about the signs and symptoms. So syphilis has 3 stages. So the first stage is the primary stage. So it's going to occur 3 to 4 weeks after the first contact, but it can actually take up to 90 days. So what's really happening here is when an ulcer forms on somebody who has the infection, and that it's just insanely contagious in that moment. So it's going to be spreading if you touch somebody's lip, if you touch somebody's genitals, and so this is how this becomes spreading. So this is actually when it's going to enter into the body, is where so the syphilis actually enters the body, and then it creates the ulcer. And then the ulcer kind of travels, the bacteria travels through the body and then creates ulcers in different spots. And it can also be in the mouth, genitals, or the rectum. So in the second phase, we're going to look at, and this is actually going to be the rash that you get all over your body. So some signs are just the rashes on the palms and the soles of the hands, and it doesn't itch, it just comes and it kind of goes. So other symptoms that we can feel are going to be the headache, the swollen lymph nodes. We're going to feel a little bit tired, aching joints, fever, could be weight loss, hair loss, or even the syphilic hematitis. So this is actually going to be the swelling, and it's going to be targeting our reproductive organs, and this is how it can be pretty harmful for a reproductive disease. The next phase is kind of the latent phase. So this is kind of everybody thinks that it's kind of gone, they've healed, and there's really no sign or symptoms that you have syphilis. So the syphilis is actually just laying dormant in the body, and it can for several years before it goes into the last stage. So it could be dormant for anywhere for 10 years before it decides that it's going to wake up and grow again. Okay, so the signs and symptoms when we get into our last phase, this is the tertiary phase, and so this is something that not many people go into, and as you can see in this slide, it's about 15 to 30% of people with syphilis actually end in this phase. And like I said, it can happen 10 to 20 years after the first contact. So this can look like in the body tumors, paralysis, you could go blind, and there can be damages to the brain and other organs. So some symptoms that you could see are difficulty coordinating muscle movements, and this is because of the paralysis that's going on. You could feel numbness, the gradual blindness all the way up until being completely blind, dementia, because it actually, the bacteria gets in our brain and it starts eating our matter in between our brain, so the white matter of our brain. You could have stroke-like symptoms, even seizures in your very late stages, and just the headache, stiff neck, fever, and then the brain swelling. So as you can see, this again is the tertiary stages. It can affect your cardiovascular, so all of your heart, and it can be as you see the brain up top. This is actually like the holes that the ulcers have started to move around the body and just to open up, and it's actually even gotten into the skull. So in the cardio, it actually it messes with your valves, coronary synthesis, and the myocarditis. And the late neurological complications, there can be, so it actually degenerates the nerves that carries into the sensory system, so into our nerve system, so we're not really understanding or getting the feedback that we need to for our body to live. And then the gumatosis, and so those are the lesions, so the diseases of the brain and the spinal cord, and we can see in that top right picture that those lesions are there. And then in the late benign syphilis, this is when it's gonna attack your skin, your bones, and then just soft tissues all over the body and organs. So as we can see in this next slide, so there's also congenital syphilis. So this is where syphilis goes from a mom who's infected onto a baby. And so the mom can see a lot of complications within the placenta and umbilical cord. So these actually swell so much that the baby's not getting the nutrients, and it's actually ruining the placenta. So the baby's not really able to grow. So the mom can miscarry, and then there's a lot of premature birth. So in mamas, this is a big deal because it's really actually causing a lot of neonatal complications and death across the world in those third world nations that we talk about. In the picture, you can kind of see the little rashes and the skin peeling of the baby there. So other complications in baby can be jaundice or the hepatosplenomegaly. So this is where our spleen is kind of enlarging and swelling. And when you have liver and spleen swell in little babies, it's not good because they can't have the output that they need, and it's not able to create the blood that they need to live. You can also see in the picture the rash. They can have it on their mouth, their genitals, their anus, bottom of their hands and feet, and also their face. If untreated, these little babies can have a lot of things that can happen to them. They could have runny nose, which actually goes into the saddle nose. So they're kind of deformities in the nose, the Hutchinson teeth. So the teeth actually form differently and look very abnormal in their mouth. They can have saber shin. So this is where the bones actually start to form differently, and so it's going to impact their walking and their ability to kind of move around as they develop. It can affect their vision and hearing. It can also handle seizures, leg and arm paralysis. So when you have a baby who can't move their arms and their legs, they're not really developing well. Some symptoms in the baby, you could have the fetal growth restrictions. So they're just not growing when they're in the mama. They could die. And then, as we talked about before, they could have liver and spleen problems, and also the edema. So this is where the blood is not really producing good blood or healthy blood to keep that baby healthy. And there also could be the meningitis, which is the swelling of the brain. In this picture, it's just kind of an overview of when you get it, primary, secondary, latent stage, and then that 72% that's not going to get kind of the tertiary symptoms that we talked about, and then the 28% that actually do and have lifelong effects. So when we look at this, we're going to look at the pathogen and the virulence factors. So here you can see in the picture that this is how it enters the body and our first response from the immune system. So it's going to enter the body through just small breaks in the skin or even our mucous membrane, so eyes, mouth, and other mucous membranes. And so the syphilis invades the immune system. So it actually goes into the bloodstream and it attaches to these cells, which then goes deeper into the tissues and organs throughout the body. So it also can do the chematosis, which is where they're putting out these enzyme toxins into the environment so that it is seeking an environment that it can live in. It also affects the dendritic cells, which are nerve cells, and then the endolymphic cells. And then it can cause inflammation, but usually when you cause inflammation, you have the treats cells, but this one doesn't have it. So it's extremely unique in its makeup, and so it's kind of has scientists kind of perplexed a bit, if you would say. So our next cell is actually just gonna, or our next slide, it's actually just gonna break it down into like exactly what this is. So it has 1,138,006 base pairs, and then it only has about 1,041 predictive coding sequences. So these are our nucleotides and the grouping of those. So it has a fairly small genome compared to other things that we've looked at through this semester, but it uses biosequencing or biosynthesis of the host. So this syphilis is actually unable to use a lot of different things. So they can't produce their own enzymes, cofactors, fatty acid, nucleotides, or any of the conversion of the pyruvate to the aspartate phases. So it really is hijacking that host and using kind of everything in it. They are doing a lot of studies on bunnies to try to find a vaccine for this. However, bunnies are a little bit different than the humans. And so in doing that, there's still a lot of unknowns and there's still inabilities to find that vaccine. So when the syphilis gets in, there's kind of like this neuroinvasion. So it's taking over and going through into the brain and those nerve cells. And they're really just confused how that's happening. And there's also that congenital transmission, so right into the baby. And they still don't know exactly how the syphilis is actually doing this. And then when the syphilis does get in the body, there's this gene conversion piece. So it's actually going under the surveillance of the immune system, and I think that's why it gets to lay dormant and kind of grow when it wants to, because the immune system really isn't been able to find it. There's also this piece that they're researching that if you have HIV, it actually speeds up the process of that disease. And also, if you don't have HIV, syphilis makes it 100 times more that you're going to get it, just because it facilitates kind of that infection. Even if you don't have it, it's kind of putting you the odds higher for getting it. So this really shows the epidemiology. So it is an infection disease that has been around since biblical times. So it goes way back. And it really only affects humans. We can't find it in animals, although we are trying to replicate certain strains in bunnies to help mice and monkeys, but it's really not the same. It really only affects just the human. So it is transmitted as an STD. It can be bloodborne or it can be congenital. Globally, it's around the world. So it's targeting groups with limited resources in developing countries. So these are people that don't have access to penicillin, aren't going to healthcare facilities to get well, live kind of on top of itself with not great hygiene, and also industrialized countries. But we are seeing that this syphilis is targeting people who live in poverty, men having sex with men, and also the IV drug users. So if we're using dirty needles and inserting it into our arms, we're also inserting the bacteria. And again, we have that increases chances of the HIV. So when we're diagnosing, the first and foremost is what they're usually diagnosing is on symptoms. So we're going to a clinic and we're telling them that we're having, that we had the ulcer, the rash, headache, fatigues, and all the other symptoms. And usually then they'll go into a blood test to see if we have the antibodies. So if we have syphilis, we're always going to create antibodies, even though our antibodies might not necessarily be killing the syphilis. And so when they take our blood, it can show current syphilis or it can show a lifetime of syphilis if we've ever had it in the past. If we have the syphilis and we're having neurological deficits, we will then get a spinal tap to see if it has made it into that spinal column and if it is going into the brain. So treatment. If you have syphilis for under a year, you can take oral, so penicillin, which is great. We have it. It's very common. Syphilis is a gram-negative bacteria, and so it's going to break down that wall, and that's how it's going to kill it. So people who are allergic to penicillin, there's other alternatives. So you have the doxycycline and the tetracycline. And so those are really helpful, but also if you are kind of in the late phase of it, then you do need to take the injection, so IV, and that's going to be the betadine penicillin. So pregnant women, unfortunately, only penicillin will work. And so if you are allergic, like myself, there's a desensitization process that you have to go through because penicillin is the only effective thing for the breakouts and to treatment of it. So also with treatment, you need the follow-up. So we need that kind of open conversation about STD that should be happening with your doctor. You need to do the blood test. So if you start treatment and they need to see where that bacteria is in your blood, if it's increasing, decreasing, staying the same, to kind of tweak your treatment. So when you have syphilis, you want to avoid any sexual contact with any partners. If you have open lesions or the ulcers on your mouth, you don't want to touch anybody. And then you also want to have that open conversation, notify any sex partners that you're having, just so that they can get treatment as well. And then again, they want to be tested for HIV infections just because it is a problem that they're kind of seeing the correlation between syphilis and the HIV. So prevention. So in prevention, we can have good hygiene. So as you see in the top right, we have a little baby over there who probably is in a third world country who doesn't always have access to everything that we have here in America. So if we could just have good hygiene, not living on top of each other, offering those countries any aid if we have the availability to do so. Also using protection during sex, screening for STDs at doctor's appointments, not sharing needles if you're an IV drug user. And then just actually in the third world kind of countries, they had protocol where they were giving everybody penicillin to decrease the syphilis in infants and adults because that's been fairly effective. So when we're looking at what syphilis actually looks like, you can see that it is a sporotype, so it's going to have that curly effect to it. It's pretty fairly small, and it can actually only be seen under a field microscope. So when we're looking under our just typical microscopes in microbiology, we're not really able to see it. The ends of it, there's pointed ends, and it lacks kind of that hook shape, but it moves through the corkscrew motility, so that's how it's going to move around. And so, as you can see, syphilis is a pretty big deal, and it is impacting developing nations as well as the third world countries. So I hope you enjoyed my presentation, and here is my references. There's a lot of really great information out there for syphilis and what to do to get help.